Hello and welcome to 12th Year Health. I'm your host, Dr. Derrick DeSilva. Back pain affects millions of people in America, and if you're one of them, there's a new treatment option using laser technology that may help. Gentlemen, welcome to the program.
Thank you very much.
Thank you.
You know, Dr. Noto, I mentioned that it affects millions of people in America, and I know it's probably one of the most common disabilities in this country.
Absolutely.
So how many millions does this back pain affect?
Tens of millions, unfortunately, in America. It's an epidemic in my mind. I mean, it's one of the most common problems people visit the doctor for. And it's one of the top 3 causes of disability in America, especially failed back syndrome, which is people who go on to have treatment or surgery and are left with chronic disabling pain that makes it difficult to perform their work.
Mm-hmm. And Sam, you said you've had this procedure. Before we talk about the procedure itself, what happened to you and how did you injure your back?
Had a common problem, a malady that a lot of people have, a herniated disc at L4 and L5. And although it's a common problem, it creates debilitating pain in people's lives. And I experienced that pain, sleepless nights, pain radiating down the leg and through the buttock, and just a tremendous problem with that, and was very thankful that there was a minimally invasive solution like the Curoscope procedure that Dr. Noto does that was available to me.
Now, Dr. Noto, this new laser procedure, I can't tell you how many shows we've done on back and back pain and back surgery. And this particular procedure, this particular laser procedure, is for who?
It's for really people with disc problems, whether it's a disc bulge, disc tear, disc herniation. It really focuses on patients that have discs that are impinging upon a nerve or injured in and of itself.
Right, so sciatica, as we have on the screen, herniated discs, and arthritis.
Correct.
Right,
Those are the main 3.
They're all inflammatory conditions.
Correct.
And they all have obviously different causes.
Yes.
Right? If you can just tell us exactly what's happening here. This is the back of the spine.
Correct. This is your back. So if you're pressing on the little bones in your back, you're actually pressing on these little bones here.
Right.
And here's your sacrum or your tailbone. And what we have here is the scope with the laser is actually entering at the bottom of the spine, and it gives us the ability to go up the spine to different levels, either on the left side or at the right side within one procedure.
Now, what are you doing with the laser?
Well, the laser, first is the scope. So you're actually seeing the disc pathology, which is very unique to the procedure. Right. You're actually going in and you're looking at the disc to see which level is injured. Once you can hone in on the level that's injured, then you can use a laser to actually repair it. You're using the laser to go in, it heats up the discs, it heals tears, and it can actually bring back or regress herniations and decompress them.
I see. Now, this can also, that was the lumbar spine, which is the lower back.
Yes.
This is what we call the cervical spine, right?
Absolutely.
The neck, the top area.
Correct.
So you can use this same procedure?
Yes, and the laser can be directed within the disc in the cervical spine to actually treat herniations or nerve compression and really take the disc and decompress it and get the pressure off the nerve.
Right, and this is the neck, right? This
Correct.
is the base of the skull
this
right here.
This is your skull, this is your neck, and here are the little nerves coming out.
Okay.
Correct.
So now, Sam, where did you have, you said your problem was L4.
Correct.
How long did the procedure take?
30 minutes.
Okay.
30-minute procedure, 3-millimeter incision, tiny incision called the Band-Aid surgery.
Right.
Walked out of the operating room, went home.
This procedure is used instead of what?
Well, this is filling the gap between major spinal fusion and things where pain management we're doing injections. So this is a minimally invasive procedure used before one of these open traditional spine surgeries.
And how widely is this used today?
Well, right now we're on the cutting edge in New Jersey and New York. It's been used in Texas and Florida for quite some time. But the technology is really advanced so that this can come to the forefront. For instance, the camera now we have is high definition, when before it was low definition. Now they're getting smaller. Our scopes are smaller, our lasers are better. So now we have the past few years the technology to really take this to the forefront.
And Sam, very quickly, we're running out of time. How do you feel now? Are you pain-free?
Pain-free, yes.
Totally?
Yes, sir.
And what about insurance? Does insurance cover this,
Yes,
gentlemen?
sir.
Yeah.
It is covered by insurance?
Oh, yes,
This is
sir.
an insurance-based procedure.
All right. Well, thank you for joining us. Welcome back, and thank you for bringing us new information. I love that.
My pleasure.
Always new is always good.
Thank you.
Good luck to you.
Thank you.
Appreciate it. Thank you
once
so
again.
much.